All right, so today we are going to be doing some thermal ultrasound on our patient Eric here, who's experiencing low back pain on his right side around the L5 vertebrae. And so some indications for Eric using ultrasound would be to help with some pain control, myofascial trigger release, and also increased collagen extensibility, and some contraindications to not using ultrasound would be if he were a female and were pregnant, you wouldn't want to do it on the ultrasound on the low back, the hips, or the stomach area. Also, if he had a pacemaker, you wouldn't want to do it, and also like decreased temperature sensation to the area that you want to do the ultrasound on would also be a reason to not do it. All right, so Eric, today we are going to be doing some ultrasound on you to help relieve some pain in your low back, hopefully, and also to promote some tissue healing as well. So basically what we're going to do is I'm going to put this ultrasound gel on you just to help transfer that electric energy to your tissues in order to heat them. And then you're not really going to feel anything, maybe a little bit of like warmth, but I'm just going to kind of be moving this around in a circle on your back. And yeah, does that sound okay with you?
Mm-hmm.
Okay, cool. So I'll have you lay down on your stomach for me, please. And then you can just kind of hang out there and relax while I set up the machine. So over here, we're gonna hit sound for ultrasound. For Eric, we're going to use 1 megahertz frequency because the lower the frequency, the deeper the heating of the tissues, which is what we want. And we're going to have the duty cycle on continuous because we're doing thermal ultrasound. And then the time will be 5 minutes to 10 minutes. And then the intensity we're going to want it to be 1.5 to 2. Let's just do 1.5. Yeah. That's it. So, Eric, is it okay if I move your sweatshirt up a little bit?
Mm-hmm.
Okay. Yeah, if you want to do it. Thank you. And then, is it okay with you if I put this towel kind of on your pants here so that they don't get gel on them?
Yep.
Okay, thank you. Okay. And then I'm just going to be putting some of this gel there. It's going to be kind of cold. And I'm going to put some on the head too. Okay, and then it's important to make sure that the gel and the ultrasound head are all in contact before you start it. So we're just gonna start here. You also want to make sure to only move the ultrasound head in an area that's only 2 to 3 times the size of the ultrasound head itself. Doing okay?
Mm-hmm.
Do you feel anything?
A little warm, that's it.
Okay. No like pins and needles?
Mm-hmm.
Okay, that's good. And so you just want to do this for 5 to 10 minutes about. I'm gonna stop. Okay. And then, you would want to check the tissue before and after treatment. I guess I didn't audibly say that I checked it before, but you also want to make sure to check it after in order to make sure that there wasn't any like tissue irritability from the ultrasound or the gel. But he looks good.